Hello everyone, Van Merkle here. We're going to talk about a case today, just a quick case. Her name is Jean and case number 28630. She's 78 years of age. She's been a patient for about 20 years. And we just did a blood test on her, an updated blood test. And she's done hair test, DMSA urine testing, which we're going to review just quickly here. And her blood test is actually pretty good. There are no signs of diabetes, kidney disease, liver disease. Her thyroid function is optimal. No sign of inflammation. SED rates, CRP are optimal. Ferritin is great. Her serum iron is a little high, and her ferritin is at 109. She has had some problem with that in the past, and we have had her donate blood occasionally. Her cholesterol is 255. Now, are we worried about that? Well, let's look at the triglycerides. Her triglycerides are 66, which means her diet's pretty good, isn't it? We going down, her HDL cholesterol is 129. That's one of the highest I've seen, 129. And her VLDL is 13, LDL is 113. Her coronary risk is 2.0. 2.0, supposed to be less than what, 4? Hers is very good, even though her cholesterol is high, not very high, high at 255. That is no problem because her HDL is so very good at 129. You don't do anything on this. This patient's diet is already great. She's got other things going on now. Do you remember in my lecture what I said could cause high cholesterol and high LDL? Toxic elements, right? As well as chemicals, liver disease. Well, she doesn't have liver disease, doesn't have kidney disease. She doesn't have infection. What does she have? She has very high levels of lead, which has been an ongoing problem. Her lead is 37, which is code blue high. I believe that's probably contributing toward her high cholesterol. It's a little bit lower than it has been over the years. It tends to be high around up in the 40s, and it's slowly come down. And so she does do oral chelation therapy on an ongoing basis. We're going to increase a little bit now because it kind of went up a little bit, so we're going to, it's been higher, but I want just a couple points. We're going to increase her oral chelation to twice a week and see if we can get her in control. Now, one thing she's had problems with is leg cramps at night. And I had her, last time we talked, I had her use or get an oxygen concentrator. This one is by Uwell, Y-U-W-E-L-L. And I don't know if you can see the numbers on there, but there's the model number and things like that. I got this online on Amazon, and I used that for my mom. My mom used to get leg cramps at night, and she used that and helped her leg cramps. Well, this patient, she used it, and she is sleeping better and having fewer leg cramps. It's an oxygen concentrator. It's not an oxygen generator. It's not an oxygen tank. It just concentrates it. You put a little cannula in the nose, and it runs for about 2 or 3 hours at a time, and my mom would sleep much better with that. In fact, she did better with that than the CPAP machine, which she quit using, and after a while, she quit using this. And so, but I'm sorry I got off, but I wanted to let you know about cholesterol. 255, find out why it's high. And that's that case. I'm Dr. Merkle.